25th, 2020 regular but remote meeting of the Burlington Board of Health to order. I look forward to seeing you all face to face, hopefully in the near future. It's been a long time. First, as we have a custom, Board of Health, Libby Wolenjevich, Board of Health member Libby Wolenjevich will represent everyone in her citing of the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Libby. We have first citizens time. Is there anybody on this call who is not on the agenda who would like to speak to the board? There'll also be an opportunity when we discuss this opening of schools. I hear none. We'll go on to the chairman's report. I am Dr. Ed Weiner, chairman, and I am here both individually and remotely as our board members. David McSweeney, who is our vice chair, Wayne Saltzman, Dr. Wayne Saltzman, member Libby Wolenjevich, and Mary Beth Welch. Also with us is Susan Luminello, our Director of Public Health, Christine Mathis, Environmental Engineer, Samantha Hardy, who is our Health Inspector. Last, I want to thank BCAT professionals who work so hard to make this public meeting possible. As you all know, we are in a declared state of emergency. We continue since about March or so. And Mr. McSweeney, our Board of Health Chair, who has done this many times, will provide the legal requirements of this evening's meeting.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who wish to listen to or view this meeting while in progress may do so by turning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook live feed, or over the telephone at toll-free 408-418-9388, meeting number 129-218-6609. That's toll-free 408-418-9388, meeting number 129-218-6609. We will also be monitoring the comments on Facebook Live to see if there are any that the board wishes to address. And as a reminder to the entire board that all votes are required to be done by roll call for all venues and virtual meetings. And with that, Mr. Chairman, I'll turn it back over to you.
Thank you very much. I have now the chairman's report. Again, please note we are live on BCAT and available for comments and questions throughout this video technology. Everyone, remote meetings and chairing remote meetings are not easy. Preparation is many times that of in-person meetings, both for the chairperson and our people who are on the board and those attending. We're all looking at monitors. I may not be able to see who is speaking, and there's no ability for nonverbal communication. So please understand, we're all doing the best we can. These times continue to be, but we are getting the extraordinary. It's extraordinary, but we're getting there. COVID-19 cases are declining. For instance, in Burlington, today we only have 2 confirmed cases and a positivity rate of 0.85%. Like many cities within this area, we are in the green on the state COVID map. Our town has and continues to face new challenges every day, challenges that change every hour, as I have seen today. They have. But as I've said a number of times, I am so proud of how people within this community has reacted. This board has met the challenges head on. We have developed and drilled and practiced for times like these. Our Board of Health, our staff, and Medical Reserve Corps continues to work every day to ensure public safety. I've read all their names many times. I only thank you all again for your commitment to the people of Burlington. Over the past month, in addition to all that we have needed to do with COVID, we've performed all the duties of a public health organization. Town development, including drainage, sewerage, site plans, subdivisions, environmental issues and inspections, health and food establishment inspections, biotechnology review and permitting, and even communicable diseases review and actions on conditions other than COVID-19. A volunteer medical reserve corps not only assisted in so many ways within this pandemic, but has also continued to work with their trainings. We attended many public health meetings, and I mean many, had multiple discussions with the school department, responded to scores of complaints involving the pandemic, and we have taken so many questions from our town citizens. Yes, the Board of Health has been and continues to be a very busy organization. I want to thank everyone who's done so much for our community. Tonight, and this is how tonight will work, we are joined by members of our school committee and leadership of our school system. As you know, we've completed and posted today a walkthrough of the high school. It was an outstanding opportunity to see what's going on in the planning of going back to school. Now, following our regular business, we will hear testimony and reports from many of these professionals, and we will have the ability to ask questions. This is a sensitive issue, and thus the process will work this way. We will host presentations from school leadership. That will be chaired by Dr. Eric Conti, followed by a question and answer period from the Board of Health and their staff, and that will be followed by limited public participation. Then, when that participation is over, we will have discussion of just the Board of Health. The Board of Health are key consultants in the opening of school and the processes involved in that process. And there will not be any voting on any aspects of the plans. But that's not the end of this discussion, as there will be a combined Board of Health and school committee meeting, a special meeting, this coming Thursday, August 27th at 6 p.m. 6 p.m. in where we will discuss and continue to talk about the opening of schools. Thank you very much. I see no subcommittee reports, so we will move to applications for a definitive subdivision, 101 Francis Wyman Road, and that will be presented by our environmental engineer, Christine Mathis.
Hi, thank you, Dr. Weiner. This application has been before the board and reviewed and decided by the board in 2016. The applicant at the current time is seeking approval for a modified site plan for the 101 Francis Wyman portion of the previously approved subdivision. The proposed work at 101 Francis Wyman is part of a larger subdivision, as I mentioned, approved in 2016, that's entitled General Walker Estates. The original subdivision plans for this portion of the project called for the demolition of an existing house that's located at 101 Francis Wyman and the construction of 2 new houses on this resultant subdivided lot. I'm going to put up the plan that the board originally saw in 2016, and we're talking about this portion in the lower left-hand corner off of Francis Wyman Road. At the time you first saw this subdivision, you'll recall that there was a plan for a cul-de-sac to provide access to these 2 proposed houses. Since that approval, the applicant has gone to the Zoning Board of Appeals to get a reduction in required frontage, allowing for the elimination of that cul-de-sac and the use of 2 dedicated driveways, 1 for each house. The other change that has been made is that instead of having a shared subsurface infiltration system, which you can see here, the new revised plan has a system for each of the houses. So in this revised site plan, you can see the individual driveways for the proposed houses and the individual infiltration systems for each house. This, as you can see, the modified plan moves the houses closer to Francis Wyman Road and reduces the impervious surface area from the original plan. This current design is consistent with the design originally approved by the Board of Health in 2016, and that post-development stormwater runoff will not exceed pre-development runoff, and the systems will fully capture 100-year storm events. So I believe Ed Champy for the applicant is here, if you have any questions for him or for me.
Does any of the board members have any questions?
Yeah, Mr. Chairman, please.
Yeah. Please.
And it's probably more for Christine than the applicant, but and doesn't have much to do with this plan, but I just want to make sure it's being satisfied since we're kind of talking about that area. But I do recall that since the houses went in back in General Walker Estates, there was some issue with, and I don't even know what the exact issue was, but there was some concern with drainage or a change in drainage plan. Have those been fixed and rectified?
Yes, they have. There was some issues with the drainage, and the planning board required a peer review of the design, and the design was found to be compliant with what this board approved in 2016 and is functioning properly at this time and functioning as designed.
Okay, great. And with this plan, and I'm fully supportive. I mean, there's less runoff and so forth, but there's no change in the grade or anything like that than from the original plan we approved.
No, there is not.
Great, thank you. I'm fine. Thanks, thanks, Chairman.
Does anyone else have any other comments? Christine, I'll ask my usual question, even with these changes. All of the drainage structures are underground and there are no detention pits. Is that correct?
That is correct.
I have no issues. Does anyone else have an issue? If not, I will entertain a motion.
So moved.
Second,
So that is Dr. Saltzman made that motion and a second by Ms. Wallenjevich. Is that correct?
yes.
Yep.
Is there any other discussion? We've seen this one before. If not, I will call, roll call. David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevich,
Aye.
Mary Beth Welch. Is she on?
Aye.
And Chairman Ed Weiner, aye. Thank you very much. That worked out very well. Thank you for all of the proponents for coming here, but we've seen this one before and it looked it was done very well. Thank you so much. We will move on to an application for a definitive subdivision in Birch Lane. However, that will be continued until the second meeting in September. Director, do we need a motion for that, or we will just hold off? We don't need a motion.
We don't need a motion. You can just hold off.
We'll hold off. Thank you very much.
Mr. Chairman,
Yes,
may I interrupt? There was in a butter for the last hearing, Marnie Smith, that posted a couple comments on Facebook.
yes.
She just said this plan puts the houses very close to the road. She prefers the original plan, and she's in a butter. The comments just came in, so I just wanted to let you know.
Well, thank you. Could you let her know, please, that this will be continued until the second week in September, and we
No, Mr.
surely...
Chairman, I think it's the General Walker, the old General Walker one that she's
Correct.
talking about.
Correct.
Oh, that's the Birch Lane, is that correct?
Right, yeah. And actually, we didn't figure if there's any of the Colin users that were here for that subdivision as well. Probably should have done that.
I guess we already passed it. We
Yeah,
saw no
right.
problems. It was no different from the
No, I
previous.
just was making a statement, yeah. I agree,
Okay.
I agree.
Okay.
Mr. Chairman, if I may too, the location of the houses on the lots is not something that is typically under the purview of the Board of Health. That would something that she should take up with the planning board. And I don't, Christine, do you know when it's going to the planning board?
It's still open with the planning board. I'm not sure if it's at their next meeting, which would be Thursday, September 3rd, but you can look on the planning board's website under meetings and it'll show you the agenda for that meeting and if it's on that agenda.
Could
think-
we
I think the
communicate?
applicant signed out.
Oh,
So
do we have contact information for that applicant?
yeah, they can call the planning board.
Okay. Whomever the applicant was, please call the planning board. They're welcome to call the Board of Health, and they're welcome to call me, but please call the planning board because that comes under the jurisdiction of their purview.
Yes.
Thank you. We're going to move on to Leahy Hospital and Medical Center, 31 Burlington Mall Road, for a review and an application for their biological safety permit. Do we have a representative from Leahy Clinic?
Mr. Chair, I'm going to recuse myself from this discussion, given my history and potential conflict with Leahy.
I understand that. Thank you so much, Dr. Saltzman. We were expecting a presentation from Leahy. Are they on this call?
Mr. Chairman, Dr. Abel, we can't hear you. Dr. Abel is here. We're having some difficulty hearing him.
Oh, please note, Dr. Abel, take yourself off of mute if you can. Is he on mute? Can you tell?
It appears that he is not muted.
He called in, so he may, Dr. Abel, you may need to hang up and re-call in. He was having some audio difficulties previously, so he called in. Christine, are you bringing up his presentation or is he?
I am, but I can't narrate it.
Okay.
I think I succeeded to connect my computer audio.
Yes, we can hear you.
Okay, I'm gonna share his slides now, and then you can tell me when to change the slides, Dr. Abel, okay?
Sure.
Dr. Abel, this is Dr. Ed Weiner. We have met a number of times. You have been with Leahy for a very long time, and
Yes.
you're a very distinguished research professional, and I want to welcome you this evening.
Thank you, Dr. Weiner, for the introduction. It's a pleasure to present again after a few years when I had an opportunity to present at the distinguished board meeting in person, and I also have the pleasure of knowing Dr. Weiner very well and several members of the board, as they have been kindly involved with our safety at Leahy Clinic. And it is my pleasure to present the 2020 Institutional Biosafety Report. I would like to start with the first slide, the next slide. Leahy Hospital has 2 research laboratories that conducts recombinant DNA work and might work with select agents. I can say that all of our laboratories are properly registered, licensed, and are compliant with all the NIH and National Institutes of Health and Town of Burlington regulations for the use of recombinant DNA technology. This is nothing new. We have been doing it for more than a decade, and the Board of Health is very familiar with our laboratories. We time to time update the information on the ongoing projects and submit the new projects as required. Our laboratories meet all the federal, state, and local regulations for the storage, containment, and disposal of hazardous waste. In addition, our laboratory safety is fully compliant with OSHA bloodborne pathogen standard, which is 29 CFR Part 1910 1030, and our employees are trained in employing all the universal precautions. All research laboratories meet or exceed the BL2, or also called BSL2, Biosafety Level 2 level criteria according to the current 2020 NIH guidelines. Now, we had a laboratory inspection on July 16, 2020, and in this inspection, the Institutional Biosafety Committee identified no violations or deficiencies. I just very briefly summarize what are the responsibilities of the Institutional Biosafety Committee, of which I've been the chairman of for probably close to a decade or so. We have oversight of all the recombinant DNA research and ensure compliance with regulatory guidelines. We also evaluate potential risk to the environment of this work and also to public health. We also monitor and review select agent usage in research protocols. I will detail a little bit what those select agents actually mean. And we annually inspect the research laboratories. Now, I didn't mention here, but even between inspections, we review as we receive new research protocols and evaluate those. If required, or if any patients are involved or any research trials are involved, we also work together with the institutional review board on those trials. Various colleagues in IRB or those who want to conduct new type of research, they actually reach out to the Institutional Biosafety Board. So over the years, we had various interesting requests on the use of like bovine fetal serum, or the use of a certain bacteria which would endanger tobacco, for example. And we didn't get involved with that type of research, even though we don't have tobacco crops here. But that was advised, not to do it. That was years ago, so not in the past year. But I just want to point out that if there's anything like a vaccine which would contain live virus or even inactivated virus, we are ready to look into those. Myself and my colleagues perform detailed research on these efforts to assure, especially if it's something like new that has not been included in previous protocols or on our select agent list, we are very, very careful to make sure that there is no risk to the environment and the public health of the Burlington community. And next slide, please. So I just thought it might be useful to the board if we briefly review the various biosafety level agents, especially as in this COVID era, this comes up, how dangerous is the SARS-CoV-2 virus itself. So before getting into that, I briefly would like to speak about the other agents. The BL1 or BSL1 agents are not associated with disease in healthy adult humans. It's like the canine or dog hepatitis is not posing a danger to humans, or we don't work with that. It doesn't mean we work with that. But also the sort of non-pathogenic Escherichia coli, E. coli bacteria, they are not posing a danger to healthy humans. And some of the recombinant nucleic acid research would involve the use of E. coli strains that carry those nucleic acid transcripts that are of research interest. So that's why this is important, but this is included in the lowest risk category, which is the BL1. BL2 is a higher level. These infectious agents can cause human disease in humans, but whose potential for transmission is limited, such as difficulty to contract via aerosol, and for which preventative or therapeutic interventions are available. So Clostridium difficile, chlamydia, hepatitis A, B, and C, influenza, Lyme disease, salmonella, mumps, measles, HIV, scrapie, MRSA are in this category. Now, when I talk about aerosol, it doesn't mean cough, it means like generation of aerosol during the standard laboratory work. Next slide, please. The next category is the BL3. These are agents which are associated with serious or even lethal human disease after inhalation, and for which preventive actions of treatment may be available. Leishmania, Mycobacterium tuberculosis, Bacillus anthracis, Chlamydophila psittaci, West Nile virus, equine encephalitis, SARS coronavirus is also in this category, Salmonella, typhi, Coxiella burnetii, Rift Valley fever virus, Rickettsia, and yellow fever virus are in this category. The most dangerous high-risk category is BL4. These are agents that pose high individual risk of aerosol transmitted laboratory infections, agents which can cause severe to fatal disease in humans, that are associated with serious or lethal human disease, for which preventative or treatment, preventive measures of treatment may not be available. So the Bolivian Argentine hemorrhagic fevers, Marburg virus, Ebola virus, Lassa fever, Crimean Congo hemorrhagic fever, and smallpox are in this category. Now one could ask, so where is, next slide please, where is the SARS-CoV-2 virus fall, where does the SARS-CoV-2 virus fall in this list? So the biosafety aspect of the COVID-19 related research for routine diagnostic testing requires a BSL2, which means standard biosafety cabinet, use of biosafety cabinet, BSL2 level, and also the standard precautions which are used everywhere in the diagnostic laboratories. Now, when procedures are done with this virus that have a high likelihood of generating droplets or aerosols, BSL2 is acceptable, or additional precautions are also required to provide a barrier between the specimen and the person. That may include even a face mask. You have the standard mask and and also a face shield and the standard precaution. So generally, like for specimen collection or standard like molecular-based diagnostic procedures or collection for further research, it can be done in the BSL-2 biological hoods. On the other hand, if the research would include isolation of the virus or manipulation of the virus, let alone culturing the virus, that would require BSL-3 level. At Leahy, we don't have BSL-3 category safety cabinets and laboratories, and we have no plans at Leahy Hospital and Medical Center. Actually, I had a question that came from Beth Israel Deaconess Hospital, where some researchers performed or plans to perform virus isolation research, again, not in Burlington, but in Boston. And they reached out to me whether I could say that BSL-3 is not required. And I really looked into this quite deeply. And the two key documents are in the footnote of this slide. One is from the CDC, which is a detailed biosafety guidelines regarding the handling of the nCoV or SARS-CoV-2 virus. And the other one is from the WHO, which also advises or provides a guideline on the laboratory biosafety of this new coronavirus. Now, in case if there will be any question about this, we currently don't do any outright COVID-19 related research at Leahy. The research that would be done at the most would be restricted to collection of plasma from reconvalescent plasma from patients or a collection of specimens for research that would be done elsewhere, but again, this has not taken place. Actually, Dr. Kimberly Rieger-Christ, our chief scientific officer, she centralized this very quickly, took it in her hand. Any research plan or ideas should go to her first, and she really made it very clear, and leadership made it very clear that early on during the pandemic, that any research to COVID-19 should be very, so there's no Wild West here or no efforts outside the standard channels, and all of the effort should go to Dr. Christ and would be also channeled to the Institutional Biosafety Committee for review. Again, the key is that for sample collection, storage, or standard diagnostic procedures, BSL-2 is acceptable, according to all the standards by the CDC and the WHO. However, when the virus is isolated, cultured, manipulated in any way, that would require a higher biosafety level that we don't have, and we have no plans to start those types of research projects. The next slide, please. Now, Leahy has the mission to advance medicines through discovery, research, and innovation, and our strategic plan includes interweaving research into the patient care experience, very high quality translational research is performed here at Leahy. Again, we are not as big as like the downtown hospitals like the Brigham or MGH, but we have some very nice, good quality research. And also the focus is on patient-centered research, and clinical research, clinical trials, and some laboratory research, which is also patient-centered, patient-oriented, and translational in nature, to bring a problem from the bedside to the bench and from the bench for use of patients, especially in the cancer area. We have very nice output and productivity. And the strategic plan also includes our desire to enhance the ability of investigators to perform research, to improve the environment, and we want culture of innovation and increased collaboration. Now, needless to say, with the COVID pandemic, a lot of things slowed down because we had to focus on making sure we were able to absorb the, the wave of patients who came to Leahy Hospital. We had to convert many of the beds to SARS, coronavirus, COVID-19 patient beds with respirators, and essentially convert them to like intensive care units. And I think we had great success with that. We actually never had to use more than about 2/3 of the dedicated beds, and we had 275 beds out of like 330 beds of Leahy, which were converted. So we had a very high level of readiness to get these patients. I don't want to get into details, but in the clinical laboratory, we made tremendous effort to bring the test in-house and achieve a turnaround time of 24 hours. And now we essentially have that pretty much all patients and cases, and even those who come back from travel get the test results very quickly. And we also implemented some rapid tests which can deliver result in a few hours. Unfortunately, there has been like a huge issue with supply chain. The manufacturers have struggled to ramp up the production to the level what the needs are, both in our hospital in Massachusetts and nationwide. And everything went under allocation where there is a greater need, and a kind of a just distribution, so nobody could really like stock up on the supplies, and that's a good thing. But the supply chain was really way behind what our needs were, so we had to step up to the plate and bring in some so-called manual PCR methods. And I'm very proud of our medical technologists who learned very quickly and worked very hard, incredibly dedicated, long hours, weekends. I'm really proud to be here. And we want to be known as a premier innovative academic medical center here. I personally also held and pitched in the new and laboratory of the Northeastern University in the Northeastern Innovation Center, which is about a mile from Leahy Hospital. They built a beautiful laboratory with high volume testing for their students and faculty, and I think this is a great asset. That center is a fantastic asset to Burlington, and I'm very proud of being involved in that as well. Next slide, please. It's probably very well known to many of you, Dr. Kim Rieger-Christ. She's been at Leahy for a long time doing beautiful research. She's working on the isolation of novel genes from various cancer lines to evaluate and define their function, working on cytokines, receptors, and the pathomechanism of cancer. It tries to identify the role of various proteins in cancer progression. She has many publications and also apply this knowledge in the development of new therapies for the treatment of various cancer types. She really started with bladder cancer in urology, but now her scope is much broader. She's been very involved with lung cancer research, in particular with Dr. Paul Haskett and others. She's doing a fabulous job, and her laboratory was one of the labs we inspected, and I can say there were no surprises there. And I can also say anytime we would do like a surprise inspection tomorrow, it would be in the same same well-organized way how that laboratory has always been. Next slide, please. Now, Dr. Lifai Guo, he is a plastic surgeon, but he is also performing high-level research in the laboratory, working on the cellular mechanism of wound healing process, which is very important. You're not just in the area of plastic surgery, but you imagine like wounded soldiers, and it has military implication also, how to improve wound healing process, which sometimes takes very long time. And plastic surgery has a great role there. It's not just all the beautifying aspect, which we hear a lot more about. So they're doing very nice work in the laboratory. They use what is called pulse radio frequency, electromagnetic energy, and negative pressure therapies. Figuring out new ways of actually stimulating the cells of the skin and the underlying tissue to speed up good healing. And his lab is also in a great shape. It's a smaller lab with less experimental work going on, but it has always been also well organized, and no deficiencies in his laboratory either. They do good work. Next slide, please. And that actually the end of my slide set, and I will be happy to answer any questions.
Do we have any questions for Dr. Abel? Susan, Amanda, Christine, you are charged with the inspection and coordinating our biotechnology permits. Do you have a recommendation?
Yes, I recommend that the biological safety permit be issued.
Since I know many of the people, I know the research is fascinating. They are using appropriate organisms and appropriate chemicals and with appropriate safety. I have no problem whatsoever, and I am proud that Leahy Clinic and physicians like Dr. Abel are part of our Burlington community. Does anyone else have any other comments, or is there a motion to approve?
Mr. Chairman, I'll be happy to make a motion to approve the biological safety permit for Leahy Clinic Hospital and Medical Center, 31 Burlington Mall Road.
I have a motion from Vice Chair David McSweeney. Do I have a second?
Second.
From Member Libby Wallen-Jevitz. All in favor? David?
Aye.
Libby?
Aye.
Is Mary Beth on? Mary Beth? Mary Beth had to leave the call for another important call for her job, where she is a director of IT, and I vote yes. And Dr. Saltzman has recused himself, so it is 3-0, actually 4-0-1. I'm sorry, 3-0-1.
301. Right.
3-0-1. Dr. Abel, thank you so much for coming. We really appreciate it. I have one question before you leave from our director. Now that we have the new system here and the new, when do they need to come back, or do they need to come back?
So they will not need to come back. Their permit will get renewed. We'll still review it, Christine and I, and we'll renew the permits. As long as there's no problems or issues, they won't need to come back again.
I'm disappointed, but thank you so much, Dr. Abel, for coming. Look forward to seeing you at Leahy, and take care, and thank you again.
Thank you very much for the opportunity and for the oversight of what we are doing in the institution. We are proud to be a part of the Burlington community. And thank you again. And if I may be excused from the rest of
Please. You have more important work.
Thank you.
Have a great night.
Okay. Permitting. So we don't go afoul, we have 130 Pearl Street animal permit for 15 chickens. Who's going to present that? Is that Samantha Hardy?
That'll be Samantha.
Samantha Hardy, one of our health inspectors. Is she there? I don't see Samantha.
She is here. I think she just needs to unmute. Are you
I can
muted?
see her. I can see her, but we can't hear her. Oh,
Can you hear me now?
There you are.
Yep.
I can hear you, yes.
All right.
Yes.
I don't know. My headphones are not working today. Anyways. Hi. So I reviewed this application. I went out and did the inspection. We measured the coop, and it was the appropriate size for the number of chickens. He does have a letter of recommendation from the owner of the property, and that should be in your files. We went over pest management, manure, storage, and everything looked okay to me. I don't see any issues with this one.
Is a proponent on the line here?
Yes, that would be me, Carlos Sandoval. Thank you for
Yeah.
your time.
Thank you. Does anybody have any questions for Mr. Sandoval?
Mr. Chairman, this is Susan. I just want to make the board aware that if you decide to approve this, he will have a permit from the Board of Health. But Mr. Sandoval is also aware that he will need to get a permit from the planning board as well.
So Susan, what is that protocol? So if they decline, I'm assuming it's for the structure?
Yeah, I think it's yeah, that's what they look at, is the structure and not so
Yeah,
much more of what we're looking at, which would be
right. Yeah, keeping the animals.
yeah.
And I'm sure there's not gonna be any issue, but what happens if they decline? Does it come back to, we revoke the permit? Does it have to come back in front of us? Like, what's the procedure there, do you know?
Yeah, so this had come up before in the past, and we were told that it's two separate permits. So what would happen is that he would not get if the planning board decided to vote no, he wouldn't get the permit from the planning board, and therefore it would be up to the planning board to ensure that the animals were removed and not the Board of Health. So
Gotcha.
they would have to enforce that, not us.
Okay.
Now, I have two questions, but I'll wait for anyone else.
I just have two questions, Mr. Sandoval. So how many chickens? Do you currently have 15 chickens on the property?
That is correct. Yes.
You have 15. And I guess the other question is for Susan, did abutters need to be notified at all? Or are there any butters that called in with any questions or concerns? I don't necessarily have any issues, but.
They were notified. I don't think we got any calls from abutters. So Sam's saying no.
No, I didn't receive anything.
All right, great, thank you.
Anybody else with questions? I have two. Since Mr. Sandoval does not own the property, does he go to the planning board, or does the owner of the property go to the planning board?
This is Susan. I'm not sure how that works, whether the permit is for him or for the property owner. I would imagine it would be for him, and the property owner needs to be notified in the same way that we do it.
Okay. And Mr. Sandoval, do you eat all the eggs, or are you selling eggs?
We definitely eat them. At this point, there's a production of like 2 eggs a day. So they've just started laying this week. But yes, the answer is we eat them. We don't sell them.
Thank you very much. Does anybody else have any other questions? If not, I'll ask for a motion, please.
I move that we award the permit for 15 chickens to the property at 130 Pearl Street, Mr. Carlos Sandoval.
Do I have a second?
I'll second that.
Okay, we have a motion by member Libby Wallenjevich and a second by David McSweeney. All in favor? David?
Aye.
Dr. Saltzman?
Aye.
Libby?
Aye.
And I vote aye, 4-0. Thank you so much, Mr. Sandoval, for coming. You have approval from this board. We wish you well with the planning board.
Thank you very much. It's been a pleasure to meet everyone, and I want to thank you for your time. This is important for us as a family, so we thank you for your time.
You're welcome. Have a good evening. Be well.
You as well. Thank you.
14 Independence Drive, kennel license recommendation. I guess that's Ms. Hardy. And Mr. Sandoval, you're welcome to stay on the line, or you can leave. It's up to you.
Alrighty. So this one, I also went out, did the inspection. They have 4, I'm not sure if they're small or medium-sized dogs. Always get that confused. But they can probably talk to you more about them. The yard is not fenced, but they have plans to fence in the yard. And they do have like a small little run area for them to run. And other than that, there was no issues from my end. And I
And
didn't hear from Jerry.
And just to explain, if you have 3 dogs, you do not need a kennel license. If you have a 4th dog, you need a kennel license. And if we do not issue the kennel license, do we? We just approve the.
We just
That is,
provide a recommendation to approve to the clerk's office.
thank you. Does anyone, is the proponent on? What is the name of the proponent?
Cynthia Carey.
Is it Ms. Carey? Are you on the line here?
I believe she did say she had called in, so she should be a call-in user.
Yeah, I spoke to her right before the meeting.
Ms. Carey, is that you?
Yes, can you hear me?
Yes,
Yeah, we can hear you.
Okay.
Okay, yes.
I just want you to be on unless any of the members have any questions. I do not. Is there any of the members who have any questions?
So this is more of a question for Susan, I think. And I think I asked this before and I forget. So and it's not our permit to approve, it's just a recommendation, which I don't have in general any issue with it. But now, once we approve the kennel license, that means she could have 22 dogs at her property without coming back in front of the board or anybody?
Yeah, there's no number. I believe there's no limit to the kennel license. I think if you had that many dogs, though, it would be an issue for us. So
Yeah, I agree.
we go out and inspect, or Sam goes out and inspects on a yearly basis. So we would know if the number of dogs goes up or there's starting to be a problem there. And then we may make an unfavorable recommendation to the town clerk.
Okay. Thank you.
Thank you.
I have no issue with the license.
Do I have a motion?
So moved.
Second.
I have a motion to provide a favorable recommendation for the kennel permit at 14 Independence Drive. No other questions? No other comments? A discussion? If not, I have a motion and a second. All in favor? Mr. McSweeney,
Yes. Aye.
Dr. Saltzman,
All right.
Libby Wallenjevich.
Aye.
I think I hear one of the
vote
dogs
aye.
barking in the background.
Yes. 4-0. Thank you so much for coming. And you have a favorable recommendation from this board. All right. At this point in time, we are going to have a presentation from the Burlington Public Schools on their reopening plan. I see here, from the best I can, we have Martha Simons, a member of the school committee, and Carl Foss, a member of the school committee. Are there any other members of the school committee for me to acknowledge?
Catherine Bond.
Oh, good. Catherine is on also. Thank you so much for Catherine Bond for joining us. Today, we had a walkthrough. It was posted. We had a walkthrough of the high school. It was led by Dr. Eric Conti and the principal of the high school, Mr. Sullivan. I'm going to ask Dr. Conti to please introduce those who make the presentation, and he is going to chair this part of his school reopening plan. Dr. Conti.
Dr. Weiner, thank you very much. Thank you, members of the Board of Health, for your time this evening. I do want to start with a note of gratitude to Director Susan Luminello. I think she's been a very important partner for us as we've navigated the tricky waters of school closure. The spring closing of schools happened on March 12th. That was a rather abrupt event, and we had to manage schools remotely. I think the summer break has seen lots of changes in sort of COVID protocols, recommendations from the state. But what I wanted to do to the board tonight, I don't want you to sit through the hour presentation that I typically do. I just have pulled out 3 slides to give some background. The district part of this is we can talk about is more of a general outline. And then I have the school district's principals are here as well for more detailed and micro level information if the Board of Health has that. So again, thank you for your time, and Susan, thank you very much for all your help and support. So Bob, you want to put up slide 1? Thank you. So just to the board, we've been along with getting guidance from the Board of Health and the Mass Department of Public Health and the Department of Elementary and Secondary Education. No one in the district, or certainly I don't, I'll speak for myself, I don't have any expertise in public health. We've been working with a group from Ariadne, and that's a group of professionals from Ariadne Labs. You can see there, they're a group from the Harvard School of Public Health and Brigham and Women's Hospital. And they've helped us frame some of the decisions that we're making around the latest science. The Ariadne group has helped schools open in other states and other countries, and they've really provided a lot of information in terms of what's worked and what hasn't. But I wanted to just explain to the board that the school district is taking a balanced view of risk. There is a risk to opening schools and returning staff and students to schools. We understand that the risk, we can't wait for the risk to be zero, in my opinion. Because there's also a risk of not returning students to school. So there are risks to both scenarios. The risk of not returning to school is certainly a loss of learning. Remote learning isn't for every child, and some of our children who need the structure and in-person learning the most are the students who are most detrimentally impacted by school closure. There's a social emotional impact. Students just, they need social interaction. And in these days, they need safe social interaction. So bringing them back into school was an important thing for us to consider. We have many students who are nutritionally insecure. Again, the Burlington Food Pantry has been an incredible partner during summer months and during the spring. And many students get their breakfast and lunch for the day from the school district when they return. So we need to make sure that we're continuing to provide meals to those who are food insecure in our district. Many of our parents, again, are struggling maintaining their work and their child and being the partner in educating their child at home. So I think that we also consider that in terms of our risk. Again, there are counseling times when many of our students get counseling services, mental health support in schools that has been more difficult to provide over the phone and over the computer. And finally, we have lots of our students who are, many of our children have a disability who need specialized supports and providing those supports again online or remotely is a challenge. So there's again the point of this slide to the board is that we understand there's some risk in returning to school, but there's also a risk to not returning to school. When we Bob, just the next slide. I'll just go through them quickly so we can move on. Again, I'm sure you all know this information, but we looked at some of the latest research in terms of looking at the transmission rates in children, making sure that we're providing physical distancing, wearing face masks, and making sure that we are looking at other best public health practices like hand washing and disinfecting, immunizations. And again, my understanding is the Massachusetts Department of Public Health just required all students to get an influenza vaccination by December 31st. So I'm sure we'll be working together to implement that new policy of the Mass Department of Public Health. Bob, the next slide, please. And I promise this is the final slide. I just wanted to stress that there's not one thing that we're looking at. We're looking at a bunch of different things in terms of protecting folks from the spread of the virus while in school. And so we're not saying there's, again, we're looking at multiple ways. Masks, the Ariadne group recommends a higher standard than the state is recommending at this time. The state is requiring students from grade 2 to 12 to wear masks. We are requiring all students to wear masks. That's from preschool all the way to grade 12. We are not saying face shields can be a replacement. We do have certain instructors that need face shields in addition to masks, and we are providing those. Social distancing is something that we are really sticking to. We couldn't give a firm answer. I think we're much better prepared tonight to give a firmer answer of the 6 foot goal. The state is saying we can run schools at 3 feet, but our goal the entire time has to be to provide 6 feet of social distancing for students. And again, we're always looking at the cohort sizes of classes for both students and teachers in terms of gathering. So again, it's not one of these things, it's all of these things combined. So Bob, I think that's it for my slides. If I could just take the slides down and talk for a minute. So we did survey our parents. And about 80% of our parents, and that's held pretty firmly over the last month and a half, want their children to have some sort of in-person experience. Um, so it's been a large majority that we've kept in mind as we've done our designs. Local COVID numbers are low, and the Burlington hybrid approach aligns with the state metrics that were released. I believe they were released 2 weeks ago. In terms, Dr. Weiner, you mentioned that Burlington is in the green area. So those metrics match with our hybrid approach to returning to school. The first step that we took very early in the summer was looking at all the guidelines that were provided to us, and we did a feasibility study. And the feasibility study was essentially looking at the space that we had in each school and the students that were enrolled, and we determined if we could bring students back and maintain social distancing in our classrooms and in our school buildings. So the result of the feasibility study was 3 of the 4 levels in the district could not bring all of the students back at once and provide adequate social distancing, which we are again pushing towards 6 feet. So at the Burlington Early Childhood Center, our preschool, that's for 3 and 4-year-olds, our middle school, Marshall Simons, and Burlington High School, the only feasible plan that we could do was that we could bring our students back in classes that were divided. We had to split the student body. So the state's calling anytime we split the student body, they're calling that a hybrid plan. And so we have hybrid plans at the Early Childhood Center, the middle school, and the high school. So only half the students will be in the building at any one time. We will have students who will be there every day, and that's a sub-separate group of kids. But the vast majority of students at those three levels will only be in school half the student body at a time. At the elementary level, we did have enough space because of our small class sizes to meet the initial guideline of 3 feet and work towards 6. I think we were between 4 and 5 initially when we looked at our total enrollment and some of our furniture configurations. Since that time, we've asked parents to choose whether they want their children to be educated in a fully remote scenario or returning back to school. And we've had roughly 400 students of approximately 1,750 elementary students who are choosing to be fully remote. With those students out of the building and with some reconfiguration of classrooms, I think we are very close to providing the 6 feet of social distancing at the in our elementary buildings. Again, the 400 students who need to be educated remotely are causing other challenges, but I do believe they've contributed to providing more social distancing in our buildings. In general, at the preschool, at the elementary school, and at the middle school level, and we'll get into specifics at each level, our objective has been to cohort students, to keep groups of students together throughout the day, and not mix students and mix the teachers as infrequently as possible. So I think you'll see features of cohort school at the elementary and the middle school. The cohorting of students at the high school is more of a challenge because the 9th, 10th, and 11th and 12th grade students all take classes together. Not every student has the same exact schedule. So we do have to have some mixing of students. But I think we pointed out to the Board of Health how we are trying to mitigate that mixing, and we're trying to address that mixing. So Dr. Weiner, because I have a lot of my staff here with me, I just wanted to speak to every level and have some of the experts at every level just go through some of the basics of their plan, if that's okay with the
Thank you. That would be wonderful.
board. So with that, I'd like to start with the preschool. And so Director Deb Clark should be here on the call. Deb?
I'm here.
So Dr. Weiner, this is Deb Clark, the director of our Early Childhood Center, and Deb runs the program that serves. It's a required program from the state, and she works with 3 and 4-year-olds in the community of Burlington. So Deb, could you go just through some features of the of your planning for student return?
Sure. So we have 9, typically in a given year, we have 9 classrooms. We have students with and without disabilities. So we're trying to plan for all those students to come back. We have 2 classrooms that are full day classrooms. They're sub-separate or partial inclusion. Those students have higher needs than other students. For those programs, we are scheduling a full return for those students 5 days a week for 4 hours a day. They would go home for their lunch, rest time, and playground time, and have a remote session in the afternoon. Those classes would be cohorted. They would just be with that staff in that classroom. Our other classrooms, we usually have morning and afternoon classrooms in order to get all of our kids together and to make our plan work and to give everybody time for cleaning and sanitation and planning. We moved all our classes to the morning for our integrated preschool classrooms. So we will have 7 integrated preschool classrooms that are running Monday through Friday, 8:10 to 11:10, which is our typical time. So we haven't changed that time. Students, as Dr. Conti said, they'll be cohorted. So they will be in their one class. They will not mix with anybody else other than coming into the building or leaving the building. We're still working on that entry and exit plan, or students coming in on the bus. So for the weeks, so all of our special ed students, they will come every day, every week. That's 5 days a week. That keeps with their current IEPs. And our neighborhood students, they will be coming every other week. We'll have an A week and a B week. So Right now, we started to do our class lists to see where kids were. We will have about 7 students per classroom, and that we can still accommodate a few more students based on the 6-foot rule and the spacing that we have. We're starting the year for our 3-hour programs, eliminating snack. Children can bring a water bottle, but we wanted to get in, see how things are going, and then maybe reintroduce snack after we get a handle on that. Our kids who are coming 4 hours a day, they will have snack. And we're working on having therapists, how to meet that inclusion aspect and how to pull kids out. We're cohorting kids so that speech pathologists, OTs, PTs don't have to go into multiple rooms to grab different kids from different rooms. They can have groups in one room so those kids aren't exposed to any other students.
Thank you.
Yeah.
We're going to wait for and answer, and we will ask questions at the end of all the presentations. That way we can talk about it and then open it up to the public. Is that all right with you, Dr. Conti?
Of course it is. I just, again, we're going to sort of present at each level. So that was our preschool. That was 3 and 4-year-olds. And just before we go to our elementary school, I was remiss in not introducing Barbara Conley, who's our nurse leader. Barbara has been working closely with Susan and Christine Pollock and in writing our health protocols. I think Barbara has also ensured that we have 12 weeks worth of PPE available for staff, students, and all of our specialists. So we're well equipped with PPE on hand to start the year. Again, at the elementary level, we have enough space in our buildings to meet the needs of having all of our students attend. So at the elementary level, we're going to have students in 5 days a week. The days are going to be shortened. So at least initially, we'd like to send the students home prior to lunch. Students will eat lunch at home, and then they will have a remote activity in the afternoon. We felt it was very important to maintain a remote activity for the teachers and the students because if the state situation changes or the numbers spike, all of our buildings may close again and we may be 100% remote. And so we wanted to make sure that we kept a foot in the remote learning door. So again, our elementary principals, John Lyons at Pine Glen, Deb Dressler at Memorial, Nicole McDonald at Francis Wyman, and David Rosenblatt at Fox Hill. Obviously, the 4 of them can't speak at once, but I was hoping if Deb Dressler's on the phone that she could speak a little bit about the elementary schedule in general. And then each of these principals, because their buildings are so unique, are working on, again, micro plans in terms of the entrance of students, the dismissal of students, parent pickup, and flow within their buildings. So I think the Board of Health got a glimpse of that this evening at the high school. But every single level are doing similar type of planning for the arrival of students. So Deb, are you on the call?
I am.
So Board of Health, this is Deb Dressler, principal at Memorial. So Deb, thank you.
Yeah, thank you, Dr. Conti. So the principals at the elementary level have also been working hard to be aware of all the guidelines and then create opportunities with all of our buildings, which are unique. So I can probably speak most confidently about Memorial School. So there has been effort by all the principals to create, again, cohorts, which gives students and teachers the opportunities of trafficking through the building in specific ways. This is an attempt to kind of protect and be able to produce really accurate contact tracing in the event that we have a case that needs to be investigated by the Board of Health. And so there are, in my building, I'm creating traffic flows for grade levels, not only through certain stairwells, but through entrance doors. Grade levels will be entering the building in through separate doors, and then going up to their classrooms in the most efficient manner. They'll also be traveling to bathrooms in a new way. So again, so that we have the ability to contact trace
students that have been in a bathroom, or as well as having obviously seating charts for classroom accountability.
Thank you.
Deb, thank you. John, do you have anything to add from Pine Glen?
Pretty similar situation, looking at flow of traffic going in and out of the building, as well as how we're going to procedurally move to bathrooms. The component of looking at Pine Glen being a little unique in that we have students in a population that will be starting hopefully on Tuesday. And there's some facilitation needs there with face shields covering over masks. So we're taking a little bit more following the guidelines given some of the populations we have in the building. But we're excited to have our students back, and I just want to thank Susan for all her help as she's been talking to Barbara Connolly in preparation for some of our students coming on Tuesday. Thank you, Susan.
And Pine Glen was a school where we really had to make some furniture changes to make sure that we could provide the 6 feet of social distancing. David, anything from Fox Hill? And again, David might not be on, go ahead, David.
Can you hear me?
Yes, I can.
Okay. So our arrival and dismissal will look a little bit differently than the other schools. Our focus was on keeping everyone as safe as possible, just starting slowly and focusing on safety. So we're going to be using the fire doors, our rear fire doors. Every classroom has one. So arrival and dismissal will occur through those doors. So students won't have to travel through the building. There'll be minimal travel. It will only be limited to students that are arriving on bus and walkers. That was really important to us. Our staff was particularly concerned about so much travel through some of our hallways at Fox Hill are smaller. And so there was concerns about travel throughout the building. So that was important. Our bathroom policies are very similar to the other schools. We're allowing 1 student in per time. Overall, our health protocols are following the same as the other buildings.
David, thank you. Nicole from Francis Wyman. And again, I think you get the flavor that, oh, there she is. Hi, Nicole.
No volume.
There you go.
Oh,
We can
am
hear,
I live?
we can hear you now, yes.
Oh, great. Thanks. Thanks, Dr. Conti. It's very similar to the other elementary schools, just in terms, we're fortunate at Francis Wyman to have a large building and large class space. So we are able to meet the needs of the social distancing pretty efficiently. So that's a bonus for us. And then just following all the other protocols and working closely with Barbara from the health perspective, we are just also planning to limit the adults in the building as well to kind of minimize foot traffic that's allowed. So that will probably be a big change at the start of school. But also just the adults in terms of teaching and support staff, making sure that those teachers are designated to a specific cohort as well, and limiting the exposure. So like everybody, just trying to limit how many students are interacting with others.
So again, thank you, Nicole. And I just going to say this at every level, but at the elementary level, what's been great is the 4 principals are working together when they're solving problems, but some of the solutions just have to be building specific, and they'll be communicating with all of their individual parent groups, and just to make sure that all the details are covered. We have purchased outdoor tents and have distributed them to all 4 elementary schools. Certainly not enough tents to have an entire student body outside underneath the tent, but we are trying to create outdoor learning spaces so that teachers can take their students outside, again, if the weather permits, and allow for mask breaks and for other activity. There's no expectation that students are going to come in, sit 6 feet apart and not move for several hours. That's just unrealistic. So we have to build in frequent breaks and opportunities for the students to get up and move around and get outside. So that is all part of our planning at the elementary level. Moving on now to the middle school, Carrie Purchase, principal, is with us tonight. Carrie?
Hi, good evening, everyone. The middle school has been extremely busy, as all of my colleagues across the district, in terms of, kind of figuring out how to open school with the current constraints. One of the things that we did early on is we realized we have quite a rigorous program for our middle school in terms of the number of special classes or allied arts classes we offered. And so beginning early on, and we typically shuffled kids a lot to go to those classes, so beginning early on, we started to identify ways to change our program of studies and still offer students those activities, whether it be art or music or computer science or health, very important topics, but we did it in a way that we were limiting the number of interactions, both with the adults and the students, and then students with other students. So one of the kind of cornerstones of a middle school is the team model. So we have 3 grade levels. In some ways, we already had cohorts established on the team because those 300 students or so were then divided into, kind of 3 teams on the at each grade level. We furthered that, and we have established and will be creating heterogeneously cohorts. So in a typical year, we would shuffle each one of those sections, and they might be in class with some of the same kids and not with the other kids. We basically, and I'll use kind of an elementary classroom as an example. So we've grouped students into an elementary classroom. And then, because we're doing the cohort model, we were able to split it into a cohort A and a cohort B. So students will be in attendance for 2 days a week and then engaged remotely 3 days a week. Based on our cohorting of students and only having less than half of the kids, because we're at about 135 students who've elected to engage remotely, which when you start doing the math, that gives us about 300 to, we'll say like 300 to 325 students in person each day. And those students will be kind of stationed in one classroom. At the middle school level, we do have content-specific teachers. And what we're going to be asking is that the adults are going to be moving from one classroom to another. So instead of trying to kind of help, and yes, we're going to have to teach kids good etiquette and hand sanitizing and do those things, and that's definitely on our priority list to do. But in terms of minimizing them going in and out of classrooms, the adults will follow those protocols with more kind of fidelity than students. So I think that was a big step that we took. And in addition to that, so we're looking at, and based on our initial classroom setups, that we can get desks 6 feet apart and have 12 students in a room. And based on the number of students who are remote, we're looking probably closer to about 10 students, 8 to 10 students with some variability there. So in our smallest kind of typical room, we will be at that 6 feet, but then we have a number of classrooms, including our science labs, that are quite large. So we will be able to, in probably about, I'd say about a third of our classrooms, be able to provide more distance for students. In terms of the flow through the building, again, students will not be transitioning from room to room. Kind of our 2 big points of movement in the hallways will be arrival and dismissal time. We have extended our arrival time, and honestly, this will be a moving target because we're not sure how long it will take. We know that more students will be coming into the building in cars, so we're anticipating more traffic, and we want to make sure that we're slowly letting kind of kids into the building. Where our buses drop off in the front, we are designating entrances by grade level that will then position students. So students, outside might have to cross paths to get to their entrance, but it'll be outside while they're doing that. We'll have 6th graders enter one entrance in our glass hallway, and then they will travel one way into their classrooms where their main classrooms are. 8th graders will travel into the main entrance and then make their way upstairs, again, kind of following a one-way route. And then 7th graders will be entering into the glass hallway by the cafeteria, which then brings them geographically closer to where the classrooms are located. We will reverse that at dismissal time, just in terms of flow and getting people out. In addition, I think that we are looking at designating one-way staircases. Again, there may be a slip with that main staircase for 8th graders, just because it's a double staircase. So in the morning it will be up and in the afternoon it'll be down, but the other staircases during the day will be only one direction at all times. In terms of the bathrooms, there's a lot of things that happen in middle school bathrooms to start with. So I understand the concern on how we would monitor that. And we, like our friends in the elementary schools, will be limiting students, even in multi-stall bathrooms, we will be only having one student go in at a time. And we're also designating certain bathrooms by grade level just to help with the flow of traffic. It will also help us if we need to kind of do any contact tracing or knowing who's in those bathrooms. And then finally, we are serving lunch at the middle school. Our students will be eating lunch inside of their classrooms. So again, we're at that 6 feet, so they can kind of, according to guidelines, take their mask off to eat inside the classroom. We had a meeting with Mr. Kuna and Ms. Damaso today about kind of getting students who are purchasing lunch to get them, bring lunches to their classrooms, kind of leave it at kind of a DoorDash for the middle school, I guess, is kind of leaving it outside the classroom door so that they can quickly get it and be able to enjoy their lunch in a safe way as we can. I think that kind of gives the overview, and I'm happy to answer any questions when it's time. So thank you.
Thank you.
Again, Carrie, thank you. And again, the middle school, like the high school, is going to be a 2 days in person and 3 days remote, and the student body is going to be split in half. So again, the middle school normally has about 850. I think it has had up to 900 students in it all at once. But we're talking many fewer students being inside the building at one time. And finally, the high school. There were many Board of Health members who heard a lot of Mr. Sullivan's presentation. So I think with the high school, again, is going to be on a 2 days on, 3 days off. So the student body is going to be split. Again, we will have students attending all 5 days, and those are high need students as identified by the state. The high school is taking traffic flow precautions, making their hallways one way. I think many of the Board of Health members saw a classroom setup where we've taken many of the desks out of a classroom and we've placed the desks 6 feet apart, and we're sort of marking where they need to stay. There are overflow classrooms that Mr. Sullivan showed to the board members, and then Mr. Sullivan went through the lunch procedures with the board as well. So drop off and pick up, I think there are great plans, and I think we're going to be working to make adjustments to those plans. See when the students arrive. But I think what we are asking all of our students and all of our families is that we're only as safe as those of us who are practicing the least amount of caution. And if the community is at a lower rate, that means the schools have a better chance of staying open. So we are asking all of our students to contribute to the safety of the community, all of our families when they're outside of school, and really all community members. They may not have any connection to school, but they are contributing by their actions, whether schools can remain open or have to shut down. So, Mark, did you want to add anything that we might have missed on the tour? I know that you've already done a pretty thorough presentation. I just want to give you a chance to add anything.
No, but I'm happy to answer questions. Again, I think that we're working on, we have a big building, so we're working on very clear signage about having one-way hallways, one direction stairwells. The lunch procedures, we're trying to fine tune them. So the lunches are at the desks when kids who pre-ordered lunches are there. So we're trying to have that process as smooth as possible. And again, I think for us at the high school, we're really going to stress to parents and students that the expectation about adhering to all the protocols is going to be vital to the success of this program, because I think we'll only go as far as because we always have young adults and at the high school, and some 16, 17, 18-year-olds. So it's going to be important that they adhere to the protocols so that we can be successful.
Again, thank you, Mark. I believe Barbara Conley's on the call. I just would like her to just say a few things, and then I'll have a couple last comments, and then I promise, Dr. Weiner, we will be done. And you've been very patient with us. Barbara has made sure all of our protocols in place. We have our teachers back on Monday, and part of their return has been they've been receiving training in our protocols that Barbara has been providing to them and answering questions. We are very fortunate in Burlington in that all of our schools have 2 nurses who will be staffed there, and we've identified an isolation space in all of our schools. So, Barbara, do you just want to speak very briefly about the isolation spaces that you've identified and worked with Susan to identify?
Sure. First, I'd like to give great thanks to Christine and Susan for all the help that they've given me all summer long. They've been instrumental in developing these protocols for our district. So thank you very much for all your efforts and your time. We have established isolation rooms in all the buildings. They have separate exits, so they will not be traveling through the building once we've identified them as being symptomatic. There will be a nurse both at the regular nurse's office in the isolation room, and we will have protocols on how to dismiss them and when they can return. So that's really pretty much it. If you have any questions, just let me know.
So we are prepared to have students isolated who present. I think a big part of our plan and a big part of the state protocols is we're asking families to do a health screening of their child every morning and not to send their child to school if they exhibit any symptoms. We're also asking all of our staff to do a personal health screening every day. And I think it's really important that they stay home if they're exhibiting any of the signs or symptoms that where they shouldn't come to work. And that should happen anyway. But I think in the age of COVID, it's even more important that again our families are doing the daily screening of their children, and that staff is doing the screenings of themselves. And then finally, we have Bob Cuna on the phone too. Bob is our director of operations. He's been very busy in terms of establishing cleaning protocols. And again, our custodians and maintenance crews have been in really since June and doing incredible amounts of work. But Bob has also worked with an outside engineering firm to have an HVAC evaluation in all 6 of our schools. Susan, I think I sent over the raw reports to you. I think we're still waiting on a final report, but every classroom, the airflow in every classroom was measured. The univents I think Bob can tell you that what happened. I'm sort of out of my area of expertise. We also had a baseline air quality measurement done as well that Bob can mention. So Bob, could you just briefly just talk about the 2 reports that are forthcoming? We actually hope that they'll be ready tomorrow in time for our joint meeting on Thursday.
Yes, thanks. So as Dr. Conti mentioned, we have 2 evaluations going on. One is the HVAC evaluation, which specifically looks at the 2 systems that we have in our 6 schools. One is a forced air system that comes through ceiling or floor vents. That is in our Memorial and our Burlington High School. Our other 4 buildings have univents, which are HVAC systems mounted on the outside walls. Both units, both styles of heating and air conditioning bring in outside air. We've also tested flows on them, changed filters, evaluated the performance of all of those units. And that is part of the report that we're waiting on the HVAC evaluation. For the baseline air quality test, we had an outside engineering firm come in. They're testing about 20 to 30% of our building, the sampling air quality. And then those reports, again, will happen now for a baseline. We understand that full staff and students are not in the buildings, but we needed to get those readings. And we will continue those measurements at least through the first month of school on a weekly basis. And we will adjust the points in the building at where we're taking those measurements from, so we can really get an understanding of our buildings. And of course, these reports will be available as soon as they're available to us. So we will share that data as well. So
Bob has made sure that all of our buildings have hand sanitizer and hand sanitizer stations in high traffic areas. And again, we have, I think we're buying it now by the 55-gallon drum, as I mentioned to to the Board of Health members during the high school tour. So we have enough hand sanitizer again to take us through the first 12 weeks or so of school and potentially beyond. So we feel like we're well equipped with PPE, with hand sanitizer. Again, all of the windows are operable. All of the ventilation systems are operable and have been evaluated. And we feel like we have plans at every level to address and to conform with the safety protocols that have been released by the Mass Department of Public Health and by the local Board of Health. And in fact, in many areas, we have a higher standard. Again, our mask standard is higher in that we're requiring all kids to wear masks, not just the students grade 2 and above. And our social distancing space, again, we are well over the 3 feet. I can virtually say we are very close to 6 feet at every level, just given the number of students who have chosen to be taught in a fully remote way. So I think we're trying to provide as safe an environment as possible to start school. I think some people, because of the news, have an image in their head of maybe some other states that have a very high positivity percentage. If our school district existed in Florida, I'm not sure that I would recommend having any opening at all. And if we were a community that had a positivity rate, again, over 5%, I'm not sure I would make the recommendation that I'm making now. But as Dr. Weiner mentioned, we're under 1% now. And I just think that it'll never be zero. And we feel that we have all the plans in place to minimize risk. We can't eliminate risk, but minimize risk and bring kids back into school. And we're doing that and also giving families a choice. If they don't want to return their kids, they can have their kids taught fully remotely. So it's actually more difficult to design a in-person and a remote system at the same time. But that's what we're providing, and that's what the school committee has approved. So with that, Dr. Weiner, I will turn it back to you.
As I mentioned earlier in the call, I'm going to entertain questions from the Board of Health. I do realize that the board did do a walkthrough today at the high school, and we got to ask many, many questions. And therefore, some of our questions have already been answered. But I will go through the board. Anybody would like to ask specific question now, as well as especially from those people who were not able, because it was earlier in the day for work, that could not be present. Following that, we will open this up to any other people on the call, and I will speak to those ground rules when we get there. But I first like to ask the Board of Health members, and then followed by our staff to ask questions. Does any of the board members would like to ask a question?
Dr. Weiner, may I?
Please, Dr. Saltzman.
Dr. Conti, members of our different levels of school leaders, thank you very much for all you're doing. I'm an advocate of our students returning to school safely, and have been an advocate of our public schools, although my children have been out of Burlington schools for a number of years now. So that being said, I'd like to ask the difficult question, or at least a difficult question in my mind, as it relates to issues in our society. And I'd like to use an analogy to draw upon for my question. Recently, at Northeastern University, students on social media posed a question about whether incoming freshmen were planning on adhering to standard precautions and social distancing upon entering school. And there were a number of students who said that they were not, that they were planning on doing what they wished to do. The school actually was cognizant of this social media post and its responses, and actually tracked down all of the students who reported that they were not going to adhere by precautions to mitigate COVID-19 spread. and held them accountable and had them undergo certain requirements. And if they did not adhere to those requirements, there was a threat that their application to school would be rescinded. So I use that as an analogy for the concept of accountability. Now we have young adults, and of course I'm not talking about our little ones, but I'm talking about those who understand the issue and the repercussions of not being good citizens. And I am just wondering, in this era also of COVID fatigue, in which individuals are really having a difficult time continuing on with many of these restrictions, albeit it is in the best interest of our community. What have you all been thinking about with regard to holding our students, staff, workers, otherwise in the schools accountable for maintaining standard precautions and social distancing while in the school at this time?
Dr. Saltzman, thanks for your question. It's a very thoughtful question. I'm going to ask for some help from at some specific levels. I think maybe high school and middle school might be there. But what I would say, just as a start, is we really try to teach the concept of community with all of our schools anyway, and that our students and teachers really make up a community when they're here, and that and their behaviors reflect not only on themselves but on the community as a whole. So not to get um, too teacher-like, but just to say, I think we are going to include students in our sort of shared responsibility. I think it is their community as well. I think many students want to be there, and they're asking us to return, and we're going to tell them they have certainly an active role and an important role in keeping that community open and safe. So I think that would be sort of our initial attempt. We always try to not necessarily lead with discipline, but lead with relationships. I think positive relationships are sort of are the foundation of a community and in respect. And so I do think our teachers are fantastic at establishing those relationships with kids. But I think also the rules have to be clear. And if any one of us wants to get a coffee at Dunkin' Donuts and we want to enter Dunkin' Donuts, we have to wear a mask or we can't enter. So I think we're going to have some clear expectations about in order to enter our community, you're going to need to follow some rules. I think there are certainly some kids with some sensory exceptions that I'm not discussing or not talking about. But I think if students are unwilling to conform with those, we do have an option. We have a remote option, Dr. Saltzman. So I think they wouldn't be welcome in our in-person community, but they could certainly continue their education remotely, and that would be, I think, part of their choice. So again, Mark, I think this is might not just be a high school. It's obviously not just a high school question, but how would you frame it any differently?
No, I think you summarized what I explained to the board earlier. Obviously, the behavior needs to be changed by talking to a student, and like Dr. Saltzman said, going over maybe the health and safety protocols and why it's important to follow these guidelines, to educate them around why it's important and to learn, if we're talking about just a gross non-adherence to the policy or protocols or just a strict refusal to do it. I think you have to identify why they're not doing it first, educate them as to why, and give them an opportunity to respond to that intervention. And if they don't, I said earlier that we will have a remote option. So discipline could look like removal from the hybrid model and put into remote. I don't think suspending the student is going to help, but I think they would just forfeit their right to be able to attend the day school because they would be putting others at risk. So I think the discipline would be not being able to participate in the day school in person, but having to do a remote opportunity where you wouldn't have the opportunity to put anybody at risk.
Carrie, anything to add at the middle school?
No, excuse me. I think that you and Mr. Sullivan did a fine job. I think it really, I think it is, we are a sense of community and we're building a community. And I think that we need to take care of ourselves and we need to teach that. Just like Mr. Sullivan said, we need to teach the why. And then we need to be consistent with that. And I think the only thing I would add is that I think that there's a wide range. Someone mentioned kind of COVID fatigue. I think that there's also kind of a wide range of people's individual families and individual citizens' beliefs about, wearing masks. It can become very politicized as well. And I think that we need to kind of take that take it out of the political realm or in the beliefs realm and just kind of say, at school, this is what we do. It's not a judgment. Families are going to, do, and hopefully that everybody's being safe and following the guidelines. I just think that we have to really kind of focus on, okay, your family might do that, but here at school, we need to do this to keep everybody safe. So I think that will be an important piece.
And Dr. Saltzman, I think that's some of that shared risk is also outside of school. So I do think we are going to ask, again, families in the general community. It's not just about student behavior in school and what happens when they're at home and on weekends as well, that they'll be taking into school with them too. So it really is a community effort in schools as a community, but also across the broader community of Burlington. And I think clearly the broader community of Burlington seems to have done a very good job given our positivity rate. And I think the reason that we are even considering opening schools is because of that community effort. And we just hope that continues.
Yeah, no, thank you very much for your responses. And I am not talking about punitive measures. I just find as I'm dealing with adults in my world who are having difficulty understanding community and citizenship and responsibility, I view this time as many have viewed this time of COVID as an opportunity to really play upon the principles that will ultimately lend all of our students to becoming much more productive and good citizens in our society. And so, much like our school system led my children and the children of members of our board to do. So I thank you all for your efforts. I support them as I always have, and I look forward to what this year brings. Thank you.
Thank you. Are there any more comments or questions from the Board of Health members?
Yeah, Mr. Chairman, if you wouldn't mind.
Please.
Yeah, thanks. And Dr. Conti, thank you so much for your time and your staff's time this afternoon. I'm sure going back to school every year is monumental in effort. This year is probably, well, I know it is, bringing more work than you probably even imagine. There's no playbook or manual to go by here, so I appreciate all the efforts. I too, as like Dr. Saltzman, am a proponent of opening the schools and going back for the school year. Was nervous though, as we all are, I'm sure, on this call or in this meeting this afternoon, about the safety of the children, and it was skeptical that we could do it in a good manner. And I have to say, after taking the tour this afternoon, that I was really impressed with everything that you folks are thinking about and how you're thinking about it. Um, it's not just a plan just to go through the exercise, but it was actually a plan that was well thought through and very thorough. So I appreciate the efforts of you and your staff. I feel as any plan is not going to be a silver bullet, if you will, and solve every case scenario. I do think that as we open up the schools and students come back in, you satisfied the bulk of the issues and the concerns. I guess so. I want to leave it at that. I think I have one comment and a question. Like I was saying, plans are great on paper, but as you open up real life situations, they're going to change. Right. And I look forward to how you evolve those plans and how you're thinking about the first couple of weeks, because even day one is going to be different than day 15, right? And I would urge you and your staff to be flexible and looking at real life situations and changing and keeping the plan fluid to the best interests of the students. So I will leave that comment, and you can comment to that in a second. I think the other part that we talk a lot about, and certainly the most important thing here is to protect the kids. But and I'm sure you're talking about this in your meetings as you're opening up the schools. I think the safety of your staff and the administration and the faculty in the schools is important to us as well. And I'd be interested in hearing some comments about some of the things that you're doing around that.
Thank you, Ms. McSweeney. Is it Dr. McSweeney? I'm sorry, I don't know that your title, but
No, I play one on weekends, but I'm not a doctor.
Okay, so Ms. McSweeney, thank you. I think the fact that I will concur that plans will need to change, and what I'll say is our guidelines have been changing almost daily. So we've been changing our plans on paper rather frequently, and I think we're sort of all trying to be as flexible as possible and understand that when the students arrive, that flexibility is only going to, the need for flexibility is only going to be increased. So I think we're all planning on that. We're speaking regularly. I think we're trying to learn from each other. We're trying to learn from our neighbors as well across the Middlesex League. So the 12 surrounding communities we're in regular communication with in terms of high school schedule and in terms of decisions that they're making. So we're not feeling as isolated here, and we're really trying to learn from others. In terms of, you mentioned protecting kids, I would say protecting staff and the adults in the building is as important to me, certainly, and to all of us. I think by taking a higher level of precaution than the state is requiring in terms of mask wearing, by really trying to promote the social distancing of 6 feet, by allowing people who work with kids to have a lot of input into our planning. I really think that's how we approached the safety again as a community. Many of our teachers want to return to in-person teaching, and we have other staff members who, for medical reasons or other pre-existing conditions, there may be a risk. So, but remember, we have about 20% of our students that need full remote teachers. And what we really tried to do is match up the teachers who couldn't be physically present with the students that were choosing not to be physically present. And looking for the win-wins is what I would say, and really trying to meet all the needs that we possibly can. There's always going to be some situations where someone is going to be assigned to a role that they may not think is ideal. But I have to say the staff has just been incredibly flexible. They want what's best for kids. They always have. And I think that I couldn't be prouder of the teachers and staff in Burlington in terms of their willingness to make adjustments in their profession. And again, can you imagine just the hairpin turn of sort of teaching in person for many years or over a decade, and then having to switch your craft completely to remote? I mean, that was just an incredible ask, and our teachers have just responded really well. So I think their safety is really important, and we've really tried to involve them and then look for opportunities to place them in the best role where they can be successful.
Thank you, Dr. Conte. I appreciate that. I think, like I said, you really thought through so many different aspects of going back to school, and I can't thank you and your team for the effort around that. And like I said before, let's keep the lines of communication open. I know you work a lot with Susan, and if there's anything that we can do to help support the going back to school, or even once you're back to school, if there are things that you need or we need to talk through, let's get back together. But I appreciate the efforts.
Libby, did you have a question?
No question. I just wanted to thank Dr. Conti and the leadership and all of the teachers in our district for the hard work that they've put in to get this whole school year underway. I have to say I'm on the fence about back to school or stay out of school, and only time will tell which is going to be the thing. But I think there's been an awful lot of thought and research put into all that I've read and all that I've heard tonight, and I just wanted to thank you for that.
Thank you. I will make a comment. I know, well, first, I think I'll ask Susan Luminello. We have one member who could not be on this discussion. Did she send you any questions?
Yes, she did. So the first question is, Will the school reopening require updates or changes to our school's emergency evacuation plan?
Susan, I think they will. We're working with the Burlington Police Department, who are our partners in sort of those safety plans and evacuation plans, to make sure that they're reflective of the new COVID environment. So the short answer is yes.
Okay, and she had one other question, which was, will the school reopening require updates and changes to the lockdown process?
And again, as part of our standard protocol, which is our security procedures, we are working with the Burlington Police to adjust them to a COVID environment. So I don't believe all of that planning is completed yet, but we are aware that we need to change our standard protocol, and we are working with the Burlington Police on making those adjustments.
Thank you. I have just a couple of questions and comment. The first is, thank you very much for doing all that you do. You and your staff have been very professional, and it is clear from the walkthrough today how hard you have worked, and I appreciate it. I've worked very closely with Christine Monaco and other members of the school committee, those people who are on the subcommittee with the Board of Health, and it is key. And those two people are Martha Simons and Carl Foss. But it's clear that the success of where we are now and where we are going is going to be in part due to the communication between us and you. And I urge that you be part of the subcommittee with Ms. Simons and Mr. Foss and myself and Dr. Saltzman, that we can keep this formal communication to continue. And I would like to be able to call upon you at future Board of Health meetings to address this board and to discuss the success or the failure or where we are with the reopening of the school. And I can see how much work you've done and how much commitment you and your staff has provided. And I sure hope it's as successful as we all pray. So thank you very much. I'm going to go back, ask now if any of our Board of Health staff, and I know that our Director of Public Health has been working very closely, if she has additional questions. I think we also have our environmental engineer as well as our supervisory nurse and health agent that are on. So if any of you have questions for either Dr. Conti, Mr. Sullivan, or the other principals, Susan, do you want to lead this, please?
Yeah, I'll open it up to my staff first, and anything that hasn't been covered, I'll add my questions to it. So, Chris or Christine or Sam, did you have any questions?
I guess
so
not.
That looks like no. Okay, so I'll start. I just want to thank Dr. Conti and his staff for all the work they've done and for setting up the meeting earlier today. I think it was very helpful. And I also want to thank Barbara Conley for all the work that she's been doing with us in the past few weeks. We've worked very closely with her on establishing protocols and explaining the contact tracing and the isolation and quarantine. So I did have some questions. I guess I'll start with the elementary level. You mentioned going outside. Will there be a recess at the elementary level? And if so, are cohorts going to be kept separate?
Again, if I could just defer to one of my elementary principals to hop on.
We have not scheduled a recess right now.
But John, but teachers could take their classes outside. Is that correct?
Teachers can take their classes outside. We'd be looking to use outside as a snack break time, not a snack break time, mass break time to allow for additional space. A rest time, we're looking at some of our specialists using the outside areas for art, music, and gym to use the outside areas and proceed along that point. And as well as we're not having lunch in the buildings specifically because of social distancing and our caps and sizes. For example, Pine Glen is the oldest of the buildings and typically the smallest in our class sizes. So some of the things we would typically like to do during a year, like have lunch, would just not be allowable.
So, Susan, what I would say, just to make sure I answer your question, is the students would be staying with their teachers when they were outside, so they wouldn't be mixing like you would normally think at a recess. So if a teacher takes her class outside, they would stay as a class. So we are expecting many students to be outside, for lots of instruction to take place outside. But again, the students would stay in their cohort.
Thank you. And then also a second question, I guess, for the elementary level, I suppose for all the levels. One of the schools mentioned limiting adults in the building. Is that going to be a procedure for all the schools?
Yes, Susan. One of the ways we're doing, we're not renting the buildings after school, for instance. So a lot of the outside groups that use our buildings the buildings won't be open to them.
Thank you. And then at the middle school level, so you mentioned you were going to use the team models. You're going to keep cohorts. So I just want to be clear, are the cohort sizes the size of the classroom? So one cohort is going to be 8 to 10 students?
Susan, again, Carrie, maybe I'll jump in and you can correct me. The way the middle school is modeled is essentially, if you think about the middle school, it's really 9 schools in one. So there are 3 6th grade teams, 3 7th grade teams, and 3 8th grade teams. So Carrie, if you want to take over from there in terms of how you're defining a cohort within the teams.
Yeah, so we're essentially taking each team and turning it into 4 classrooms. One of those cohorts, like so if you have say 80 students, that would be 4 sections of 20, and then those 20 are then split into to A, which would attend Monday, Tuesday, or B, Thursday, Friday. So those students will stay together for, I'm going to say 99% of the day. There may be a need, and kind of the guidelines from DESE doesn't say that kids can never transition. It just says to limit transitions. So there may be a need in terms of world language where we might need students to leave one classroom and go to another classroom to be together. But when we're doing that, they would still be on the same team. So it would still keep the, kind of that bubble around 80, so to speak. So also played into that is that each team, so it's actually 3 sections of in-person on each team, and there would be 1 section of students that would be at home as well, so the virtual section.
So a cohort size would say be 20?
So split, so it'd be in half. It would be more like, I would say that none of our cohorts are going to be over 12, and that was based on, all students returning. So if 100% of our students came back, we would be at about class sizes or cohorts of 12. And because we have about 135 students school-wide, we're down closer between 8 and 10 once we kind of, separate them out.
Yeah, that's great. So are you keeping track when, a student from one of those cohorts has to leave in that 1% of time? Okay.
Yes.
Okay,
so
we will.
So it'll be in their schedule. So we'll know, for the guidelines around the contact tracing. So we'll know which students are going to which space, and then where they're going back. So we'll be able to identify that pretty quickly. I think that in terms of, kids, going to guidance or going, sometimes kids need to leave to go someplace else. We'll also be keeping track of that as well. So I think that we'll have pretty good information on when students leave their cohort, their bubble, their classroom. We'll know kind of where they're going and when and if they're interacting with other students.
Great, thank you. And then for the lunch, is the cafeteria going to be open, or are they just going to be doing bag lunch and then sending it to the classrooms?
So the plan is that that the cafeteria space in general will be open, but honestly, we see adults using the space and spreading out in the space. Students will not be going to the cafeteria. They'll be walking through because that's kind of a main pathway to get to some of their classrooms. But we're not opening the lunch line. We're not serving tables. The students will bring the bagged lunch. So say in that group of 10 students, maybe 3 of those students bought lunch that day. So our cafeteria staff will bring 3 lunches up to that space. The students will those lunches and then go into the classroom and eat. Some of our teachers may choose on, especially when the weather is nice, to bring their classrooms outside to eat as well. So that's something that they're exploring. But so I would say for all intents and purposes that the cafeteria is not open. They're serving food, but not, open for food.
Great, thank you. Dr. Weiner, there is one question from Facebook. I don't know if you want that question now.
When you're done, I'm just going to now close this session for the Board of Health. Now, I want the ground rules for the public, and we invite you. Please ask relevant questions. Please be professional, and please be respectful. Everybody's doing best they can, both the elected, volunteer professionals, and the school and board of and school committee, and the school professionals have been working tirelessly, and I know 7 days a week for many of you to try to ensure a very safe place for our children. And I'm not alone in experiencing a sleepless night or two just thinking about how we can help this process go forward. And yes, if I've had some sleepless nights, I know you have, Susan, and I know that the school committee and the school departments have also. So thank you. So now I'll open this up to the public. I'm going to try our best to, and you can start with your Facebook. Is the person on the line who could ask the question?
No, it was typed into the Facebook feed.
Okay, please type, please, let's go with that one first. And then if anybody else is interested in speaking, I'll try to acknowledge you.
So the question is, I guess it's more of a statement, but have not received information as to whether or not the reports will include the air exchange rate. So I guess the question is, will the reports coming up include the air exchange rate for the classroom?
Bob?
Yes, the reports will include the air exchange rate. They will also include the classroom size and the flow coming out of the either vent or machine as well. So it will be addressed.
That's it for the Facebook questions.
Is there anybody on the line here? And I see that we have 30 people. This is one of the largest Board of Health meetings. 30 people. Does anybody else have a question for the school committee, for the school department, or for the Board of Health staff or Board of Health members?
My name is Michelle Smith. I have some questions.
Please, Michelle, go ahead. Thank you for joining us.
Yeah, thank you. And first of all, I want to thank Dr. Conti and Susan Luminello and the members of the school committee who have been very kind in answering my questions when I've contacted them, and I know I've put a lot of work into making this plan successful. So I had a follow-up to the air quality measure question on air exchange rate. Is there going to be a measure of outside air that's being brought into the buildings, or is that just a measure of airflow?
Ms. Smith, thank you for your question. I don't know the answer to that. Bob, the engineer is planning on coming or being available. Is that correct? Or do you know an answer to this question?
I guess I probably would like to have the question rephrased. What do you mean by measuring the airflow from outside? Are you talking about a damper on any of our units being open in comparison of what it's taking in for fresh air, or do you mean the flow coming through the machine? Because the damper will be variably adjust, and the flow coming through the machine will be tested and addressed in the report. So yes, Dr. Conti, I believe that the engineer is planning to attend or can be available for the meeting on Thursday. But again, Mrs. Smith, if that addressed your question, as I hope it did, then please let me know.
I'm not quite sure, but I'll come back in on Thursday and maybe I can try to rephrase it before then. But it's just that everything that I've read so far has really led me to believe that bringing in outside air is really helpful. And so I was wondering how that would be measured. So I can do a little more research on that to have a better phrased question for Thursday.
Okay.
Thank you very much, Ms. Smith.
I had two more questions, if you
Sure.
allow. Just to follow up on Dr. Saltzman's question about holding students accountable. It sounds like all of you have thought about this, and I'm wondering, will there be some sort of policy? Of course, you want to keep kids in school, but will there be, after some number of issues have come up, when students would be asked to transition to remote learning?
Ms. Smith, I don't believe it will be that formulaic. I don't think that we're going to allow multiple incidences, but I think we'll certainly have a warning and then deal with all the students individually. Again, I think any of these conversations are best led by the people who know the student well in terms of what works for them. So I don't think we would ever have a formula like that, but we would expect compliance with our expectations.
Thank you. And then I have one final question. So Dr. Conti, you had mentioned that the space in the buildings will not be rented out to outside organizations. And I believe that that includes the YMCA after-school program, which has, I think, really filled a gap in the community, and my family has used it for many years. And so my question is, so for the elementary schools, I think there's only 3 hours when students will be in school. You'd mentioned that parents need to work, and so they'll need to go somewhere after that. I know there's limited capacity in the in-school after-school programs, and so I'm wondering, what is the impact on your ability to contact trace with the fragmented after-school experience, because there'll be many other students who are now going to need to go elsewhere with the Wi-Fi space, who will need to have that gap filled for them by other programs that are not offered by the schools.
Ms. Smith, I do believe the after-school program will add some complications. I think what we are trying to do, or what we are doing, is keeping the after-school programs, keeping the students in the school from which they're from. So typically we would bus Fox Hill kindergarten students to Francis Wyman or something like that at the end of the school day. All the students from an elementary school will stay at that elementary school. By not having the Y there, I think we have more space to expand the Burlington After School program. Again, I'm a supporter of the Y program. We're just trying to limit the number of adults in the building. And again, our hope is that if we start slowly and cautiously at the elementary level, we can continue to add time and continue to lengthen the school day. So I do hope, barring a whole lot of other factors, that we can continue to work towards having a full school day, actually at all levels. But that's really going to depend on how we act as a community and what the virus does. So I understand daycare is a critical need, and we are trying to provide coverage for as many families as we can until 4 p.m.
Dr. Conti, if I could also add to that. So I just wanted to add that the responsibility of the full contact tracing and case management investigation is the responsibility of the Board of Health. So there will be children attending programs after school that may not be run by the school department. So once we have a positive or a probable case, the Board of Health will start their investigation, and we will contact parents and find out where the children were outside of the school area. So that's a key component of what we will be doing in the event of a positive case.
Thank you.
Thank you.
Is there anybody else on the line who has a question for anybody here on this call? Well, I guess that's it. I want to thank Dr. Conti, Mr. Sullivan, all of the principals, Bob and Barbara. Thank you all. This has been just terrific. The walkthrough today was very, very educational. This call was very helpful. We had a lot of people on who have watched it, and I hope you've provided the answers to many of the questions that people were having from the community. Again, this coming Thursday, we will again be meeting in a joint meeting with this with the school committee. And if people have additional questions, they should tune in to possibly get the answers. Mr. Conti, thank you so much. Thank you, everybody. Been a great day. Thank you. Be well, be safe, and we will be talking.
Good night. Thank you.
Good night. We have one more agenda item that does not involve the schools. The school department, the school committee are welcome to stay on, but at this point in time, I'm just going to thank them. We have staff reports right now. We have the environmental engineers report. Do we have Christine Mathis on the line?
Yeah, I'm here. Thank you.
Can you provide us a couple of highlights, please?
Sure. I wanted to point out that we are planning to go ahead with household hazardous waste collection event on September 12th. We're going to make that a contact-free event, and we've been working on the rules for that. And I would point out that anybody attending the event needs to remain in their car at all times, needs to wear a mask while in their car with their windows up at all times, and needs to have all of their waste materials in the rear of their vehicle. This will be posted on our website with additional information. And if there's any board members who would plan on attending, if you could reach out to me individually, that would be helpful. Quick update on mosquito risk levels for Burlington. We're currently at the lowest levels for both West Nile virus and Eastern equine encephalitis. So that's good. Those are the two highlights I had for tonight. Any questions?
Does anybody have a question?
Yeah, I do. Christine, just, I don't know if it's, you can address this or Susan, but I had sent over some pictures of the parking lot over at Staples, Wendy's, with the runoff issue. Can you just give me an update as to what's been going on with that, if anything, and what the next steps are?
Susan, do you want me to take that? Okay. So we had made the the property owner aware of the situation just before the pre-COVID, if you will. And there had been some correspondence back and forth with their engineer and attorney. And I have some plans and have done some initial review, but it needs further review and contact with their engineer. It was kind of put on hold, if you will, with the attention to COVID that we've been paying. But it is on the list.
Yeah, that's great. I get it, right? We have pressing priorities. I just don't want to lose sight of it, only because and it's not just the water that's sitting there, but when, I don't know if you've been by lately, but there was garbage in the water. It had been sitting there for a while. It looked like a dirty pond, and I'm just concerned about the health hazard. So I get that we have to go through it. It's probably a big project, right? And I get that. But is there, any way we can follow up with them or send them a note to at least try to clean it up or keep it somewhat clean? There, like I said, there was garbage in there. It was just mosquito. It was just gross. It was dirty.
Yeah, I'll try to reach out over the course of the next week. I also need to coordinate with DPW engineering, and I think now might be a good time to reach out to them because water levels are low. We're in a moderate drought, and there may be some availability for them to do what they need to do to draw down the detention basins there.
Right.
So I'll reach out.
That'd be great. Thank you.
Yep.
Any other questions? I have just one. Can you just please maybe comment with the FDA update that people should not be buying hand sanitizer that contains no materials other than isopropanol and ethanol, and not methanol and other types of solvents.
Sure. So about a month or so ago, the FDA put out a warning and then a recall for hand sanitizers containing methanol, and a lot of which were imported from Mexico. Methanol is toxic and not appropriate for use in hand sanitizer. And more recently, just in the past few weeks, they put out a secondary warning about hand sanitizer that contains 1-propanol, not to be confused with isopropanol, because you want isopropanol in your ethanol in your hand sanitizer, but the two you don't want are methanol and 1-propanol. And they keep updating the list. If you just go on the FDA's website, or you can just Google FDA hand sanitizer, there's a list. It's about, I think the last time I looked, which was when I prepared this report last week, there were 175 individual hand sanitizers listed that should not be used because they contain one of these chemicals that are not appropriate for hand sanitizers.
Thank you very much.
Yep.
Any question? Not if there are not any more questions, I'll ask for a motion to approve the environmental engineers report.
So moved.
Second.
I have a motion and I have a second. No other comments or discussion? If not, David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevich,
Aye.
and I'm aye. 4-0. Okay, with the associate health inspector, Samantha Hardy, would you have anything you'd like to present?
Hi. So I guess I can say Marlene and I finished as many of our COVID pre-inspections for the restaurants as we possibly could. And now we've started back on our regular routine inspections for restaurants. So we're as many as we can get to. Some places are still closed. We're trying to work with places to figure out when everyone's opening. But for the most part, we're back on our regular schedule for food, unless things change, but hopefully it stays this way. I've been working on the MRC training, so we've been trying to get some of the trainers that we were working with back in March before everything kind of got crazy, to see if they will do virtual trainings for our volunteers. So that's one thing that we're working on. And also I was very busy with camps. There weren't that many this year, but it was a process going through all the guidelines with them. But we had 2 camps that ran, and a couple that decided not to run this year. But they're all set. Everyone's permitted.
Do we have any questions for our associate health inspector?
Mr. Chair, I do.
Yes, please, Wayne.
Hi, it's Wayne. So I'm just curious about roughly what percentage of Burlington establishments have not reopened as of now?
I don't know a percentage, but I know it's a good amount of mostly the corporate cafeterias, the ones that work in corporate buildings. Those are all have been closed for a while. They usually are slow in summertime anyway. So a lot of them have chosen to wait until after Labor Day to open back up. But most of the restaurants really have opened. I think we've only had 2 that have gone out of business, maybe 3. So I think for the most part, it's really just corporate cafeterias and a couple of the hotels that haven't opened their food service yet.
Thank you.
Any other questions? If not, I'll entertain a motion to approve the Associate Health Inspector's report.
So moved.
Second.
I have a motion by Mr. McSweeney, second by Dr. Saltzman. No discussion. All in favor? Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Libby Wallenjevich. Libby, you there?
Yes, I am. I forgot to turn my thing on. Yeah, aye.
And I say aye, 400. Thank you so much. The next is the public health nurse. Ms. Pollock.
Good evening.
First of all, before you go any farther, I want to thank you. I have called to you almost every day, and you've been very, very patient with me. Thank you so much.
You're welcome. So just a couple of highlights that I have. Obviously, I've been very, very busy with community surveillance, communicable disease surveillance, COVID-19 contact tracing. It's been a long road. And so right now I am having a presentation because we're getting ready for our flu clinics. Probably getting set up to schedule some mini clinics for our first responders, our seniors, and the public, and also staff, starting in September. I just want to let everybody know that I will be doing a presentation on child vaccines and immunization, and also on how to administer a vaccine to a child. I had done a couple of these previously before we had our last EDS drill last year, which was pretty successful. We gained, I think, 2 or 4 Susan dispensers from that for child vaccines. So I'll be holding that on September 2nd in the evening. For anybody that's interested, BVRC or public that are nurses that are interested in becoming either a volunteer and want to administer vaccines to children. And the upcoming flu clinics, and I cannot stress how this year is going to be extremely important to make sure that you get your flu vaccine. And other than that, that's really all I have for highlights. Oh, and we are in preparation, if it's still going to be held, but we do have a date in March for our rabies clinic too. So we've been working on that. So that will be coming up. I believe it's March 14th. Don't hold me to that date because it's in March on the Saturday before, I think the last one we had, which was the 20th. So, and I think that's about all I have for that, for my report.
Mr. Chair, two questions.
Oh, you got an echo here. Let me mute.
Please, does anyone have any questions?
Yeah, I have 2 questions, actually. Thanks, Mr. Chairman. Chris, yeah.
Just don't go on mute.
I'm unmuted.
You should go on mute, I think. 2 questions. Well, and one I just thought of because you just mentioned it. But how popular is the rabies clinic still? Do you remember how many we got last go around?
We had 35 people show up at the last one. I think we had 30, we had a little bit more than 35 at the one before. So we're hoping for a good turnout, but again, with the COVID-19 situation, we are still in the planning for that in March. So hopefully it'll be a good turnout.
Yeah, good. I remember when I was, well, I'm going to be dating myself. I was a little kid. I waited in line. There must have been hundreds of people at the rabies clinic.
Yeah.
My father dragged me there every year, not from my rabies shot, from my dog. The question I had is, you're right? We're going to see an increase in flu shots, both because of the governor mandate on school kids, school-age children, but just in general, I think we're going to see an increase. Are we increasing, and maybe Ed, I don't know, or Susan as well, but are we increasing a purchase of flu vaccines? Are we preparing for that, or are we sitting tight, or what's the expectation?
This is Susan. I can answer that. So right now we're not planning on purchasing anymore. I think what we need to do is kind of give out what we have at this point, and the opportunity, I believe, will be there to get more from Department of Public Health if we need to do that. One thing I just want to point out to the board is that we haven't yet received the standing orders that we need Dr. Saltzman to sign to give out the flu vaccine. So we're not going to be able to give it out until we get the new standing orders, or if they say you can use last year's standing orders. So we don't know that at this time. That's something that Chris has been waiting for. So we do have vaccine here. As soon as we get the standing orders and they're signed, we will begin giving it out. And the plan is to give it out in a drive up manner so that they would make appointments, drive up to this building, park, come in at their appointment time, go out and go out a different doorway. So we're going to use the Murray Kelly room to administer vaccine that way.
And what's the date of the flu clinic again?
So we had a date scheduled, but I don't, because of the COVID standards, I don't anticipate that we're going to be able to do the regular EDS
Right.
type of
Yep.
drill. If we do move toward that, so if we find out we're giving out all our flu vaccine and we need to purchase more, or we need to get more and hold a larger type of clinic, then I would like to plan for possibly a drive-through option. So I have gotten some templates for that, and that's something that we need to look at, and possibly doing a drive up type of thing rather than having everybody come into one area.
Yeah, I would agree. Okay. Thank you very
Susan,
much.
anybody else have any questions for Susan? Susan, I have a couple of flu vaccine questions. Are we going to have senior dosage, and how many this year? And there are also a group of individuals that we go to their house. Are we going to be able to do that this year?
So we do have high dose. Chris, do you know the number on that? Is it 100 and?
It's 170 doses.
70?
Yep.
Okay. And because of it, we were not planning to do the in-home type of visits.
Okay, thank you.
Did he really call it senior dose?
That's what I get.
Yes, we did.
Okay.
So again, on the flu clinics, we're going to do a lot of mini clinics so that we can spread them out, and also be able to hit like our first responders, our staff members, employees of the town, and then the elder population clinics, and then also our family clinics. So we're going to try to do them in smaller, with maybe 2 to 4 dispensers, and have them, like Susan said, drive up and have an appointment time and come in, maybe 3 or 4 at a time, and book them 15 minutes apart so that not everybody's in the same room for a long periods of time. So.
Will you need to save those elder clinic dose for Dr. Saltzman?
My record is 900, administering 900 in a day.
Oh my gosh, I'm going to get it now.
But yeah, education this year around flu vaccination is more important than ever, and I would urge our community to make sure that you are educated about the flu shot and issues around it, like it does not cause the flu. Things that have made people not want to get the flu shot, and even understanding what the effectiveness of the flu shot actually means. So I can blatantly say that getting the flu shot is one of the best things that you can do to maintain your wellness and preventative health practices in this year, especially this year. Please, everyone, consider getting your flu shot. Please, unless you absolutely cannot do it for health reasons, please get your flu shot.
And please get your information from a good source. I was on on Facebook, and somebody was complaining that there may be dihydroxide in flu vaccine. Dihydroxide is water. So please get your information from a reliable source. And we have a wonderful public health nurse and supervisory nurse and we have a wonderful director, and please feel free to call the Board of Health. If there are any other questions for our public health nurse? If not, I'll have a motion to approve.
So moved.
Dr. Saltzman.
Second.
Second, Libby Wallenjevich. All in favor? David McSweeney.
Aye.
Dr. Saltzman.
Aye.
Libby Wallenjevich.
Aye.
And I vote aye, 4-0-0. Last but not least, we have Director of Public Health, Susan Luminello, back from vacation last week from Alaska. And Susan, we survived without you. I don't know how, but we survived without you. And thank you for the rest of your team who were wonderful. Susan.
Yes, thank you. So my report mainly, as you can see, is COVID, responding to COVID-related complaints, issues, and questions. So I was going to talk a little bit about what we were doing for the flu, but we've already covered that. So if you have any questions, I'm happy to answer them.
I guess, Susan, we saw you this afternoon. We heard you tonight. I guess we're all questioned out. Thank you for everything you do.
Yeah, actually, I do have one question, and maybe it's a comment, or I guess this could be a question, but I see smattered throughout everybody's report complaints or escalations about Lifetime Fitness. Do we have an issue there that we need to discuss more globally, or is it just one-off situations? I just want to make sure they're being good corporate citizens in the community.
I was able to resolve that, and hopefully we will not get any more complaints.
Okay. I would say that if we do, let's talk about it at the board meeting. If it comes up again, like I said, it seems like it comes up a little bit more frequently than it should, and I just want to make sure we're on top of it.
There were several different issues, one having to do with the pool and where the pool chairs, deck chairs were located, the occupancies of the rooms, the fitness room, occupancy of the fitness room. And initially we had an issue with the distance of the fitness equipment. We had another one on the use of the showers. So I work very closely with the manager there, and through different avenues, we were able to resolve each one of those issues. So I'm hopeful that, they understand now. A lot of what we do is education on the standards and the reasons why we have them. And if we need support from other agencies, we will get that if we have to. And it seemed to have worked out. And hopefully none of those issues will come up again.
Right. Okay, great. Thank you.
Susan, thank you for all you're doing. I know you answer many questions. You take my calls every day. You take calls from the board members. You've become the face of the board. We really appreciate it. With that, do I have a motion to approve the Director of Public Health's report?
So moved.
Second.
Dr. Saltzman, and I guess that was Libby Wallenjevich. Is that correct?
Yes. Yes.
All in favor? David McSweeney.
Aye.
Dr. Saltzman.
Aye.
Libby Wallenjevich.
Aye. And
I vote aye, 4-0-0. We come to the end. This is one of the longest meetings we've ever had. I want to thank Dawn Cathcart. She is our recording secretary. I wasn't sure she was going to be on today, so I didn't announce that she would at the beginning. But Dawn, thank you for everything. I know you have done beautiful work, and we appreciate it. I want to say thank you. You're welcome. I want to say thank you to all the board members. I know you're very busy in this community. Thank the staff. You're even busier. And with that, please be safe. Please be well. please wash your hands. Is that okay, Dr. Saltzman? I'm going to continue your legacy. One of the most important things that you can do is wash your hands frequently.
It's a trilogy, Dr. Weiner. Wash your hands, wear your mask, and maintain your distance. A trilogy which we're going to be talking about for a long, long time.
And with that, do I have a motion to adjourn?
So moved.
Do I have a second?
Second.
Jane Saltzman and David McSweeney, and to a vote the last time tonight. David?
Aye, aye.
Wayne?
Aye.
Libby?
I'm disappeared.
You disappeared, and I vote, you
But-
vote yes?
I vote yes.
And I vote yes too. And with that, good night, everybody. Be well.
Good
Thanks,
night.
Ed. Appreciate it. Good night.
Motion adjourned. All right.